Texas Bariatric Specialist offers a full-time medical and surgical weight loss clinic in Austin. One of the most frequent questions that I hear is, what's a doctor from San Antonio doing with an office in Austin for surgical weight loss? Because the perception is that there's a lot of surgeons that are available for weight loss surgery in the city of Austin. In reality, all we're trying to do as a group is to raise the standard of care for surgical weight loss within the community. What we've done is created a one-stop shop that we've delivered all the way up to Austin. It's unlike almost any other program that's in the Austin area when we think about it. In one of my visits, you'll be able to see me, the nutritionist, and the psychologist all in one stop. And that's really important when time is of the essence and trying to be able to make good use of a day off from work. So we'll be able to do all three of those evaluations for you in one sitting. You walk away with a really good insight into what your risks for weight loss surgery are, what operation may be right for you, and whether or not insurance is going to cover it. To be able to answer all three of those questions in one setting are really important. And in reality, almost 70% of the paperwork that you need for weight loss surgery is completed in that one comprehensive visit. After that, we continue to raise the standard of care in regards to how we support the program after surgery. I'm one of the only fellowship-trained bariatric surgeons in the greater Austin area. When we talk about my fellowship, it's specifically in bariatric surgery as compared to a minimally invasive fellowship like a lot of other surgeons have done. The bariatric surgery fellowship teaches me how to put a program together that will best meet all of the needs of the patient, not only before surgery, but after surgery, because the success of weight loss surgery is really driven by the aftercare program. Our aftercare program in the Austin area is second to none in my opinion. We have a nutritional resource store, we offer metabolic testing, we have our psychologists attend almost all of our support groups, we have a support group schedule that is really well thought out. It helps provide insight into all types of weight loss surgery procedures as opposed to just a specific type of procedure. And we have a comprehensive group of people that get together every time we have clinic. So when you come in for follow-up, your needs may be different. One person may need to spend more time with a nutritionist, the other may need to be able to spend time with a psychologist, and the last one may be having some belly pain or something else they really need to see the surgeon. So walking into our office at any point in time, you'll be able to see any one of the three specialists at one time. And I think that this dedication to weight loss surgery is very, very different. It's a commitment that's different than anybody else in the area. Lots of the groups in the area have multiple surgeons with no dedication specifically to weight loss surgery. They provide great surgical care, but the aftercare program and the management of the patient during the insurance process becomes frustrating because there isn't one specific person to talk to. There isn't a person that does this all day, every day in a doctor's office, like in our office, that's going to take care of your needs specific to weight loss surgery. And I think that those things are very, very important. The second question that patients ask me from Austin is that why do I have to go all the way from Austin down to San Antonio for a little old weight loss surgery? In reality, weight loss surgery outcomes are driven by who does your surgery, where you had your surgery done, and what you bring to the table. We'll assess what you bring to the table on your one-on-one consultation. But when it comes to choice of surgeon and choice of facility, it's really important that they're married up. When I choose a facility for weight loss surgery for you, I'm going to be looking at your risks that you bring to the table, and then where you're going to be able to have the safest operation with the best aftercare package available within that hospital. And so we would choose one of two facilities for you. The one facility is a larger hospital that has a dedicated bariatric ward, unlike hospitals here in Austin, where all the patients on that ward have had weight loss surgery. It's the only thing that's admitted onto that ward when we're operating that day, such that the nurses know exactly who you belong to, what surgery you've had done, and exactly how I want you to be taken care of, as opposed to being on a general surgical ward where persons had brain surgery, back surgery, spine surgery, and gastric bypass surgery all in the same unit, where the nurse has multiple different things to look at for multiple different patients. So a streamlined care package within the hospital is very important. This hospital is on track to do over 600 operations for weight loss in 1 year. That may exceed the total number of gastric bypasses done in the entire city of Austin, just in one hospital. So you're really going to a specialized hospital, which the hospital is defined as a hospital within a hospital, because you're in this isolated area where there's specialized care. The second facility is a little smaller, but it provides concierge service. It gives you nurse-to-patient ratios that are second to none in the country, and it gives you a dedication to weight loss surgery because that's almost all that they do, which is second to none in the region. And this hospital is really specially designed for weight loss surgery. So this is the thing that we kind of emphasize when it comes to your overall safety and your overall aftercare experience, because it's nothing more frustrating to have to wait on your pain medication, or the nurse really not knowing what you had done, or knowing that you can't get out of the hospital until the nutritionist sees you, but the nutritionist has never seen you because they don't know what weight loss surgery is really about. So our commitment to the community in Austin is really second to none in being able to provide you expert surgical care, a care environment which is second to none, and support after surgery, which really is raising the standard of care in Austin altogether.